now got 45 minutes for our open discussion and the panel. Like I said, we shall start off by permitting one person in the audience to ask one question to each of the presenters, each of the presenters. And we start with Simon's presentation on EInfrastructures: what, why, how, and who. Does anyone have a question for Simon? Going one. Going two. Going, yes, Isaac Kasana. So we're just going to take one question. We'll come back if there's more time.
Thank you very much. You mentioned something about reaching out to communities to translate e-infrastructures for Africa into useful applications. How is this happening and how is it going?
Nowhere near as fast as we'd like. So the way we recruited people is that about 2 years ago we put out an initial survey through the For Africa project. And that was quite an open survey which tried to capture how interested people were in infrastructures. That was then analysed on a quarterly basis. So the survey's still open if you want to sort of fill it in, but the one that I've distributed is the sort of easy version, then we can follow up later. But that was then analysed for communities of practice. So we reached out to the people who filled in the survey, and there were about 320 of those. And then through that, say, well, do you have a community of practice, or are you involved in a community of practice that you believe could benefit? And we helped to expand that into the 34 that we have. Now, conversations with stakeholders in that 34 list have sort of led to a prioritisation of who we can help initially. So, for example, the science gateways that we showed in my presentation, we're sort of at the beginning of trying to feel a way through to how to create these with communities, but the ABIST Science Gateway that we created was absolutely fantastic because we had significant cooperation and support from ABIST themselves, and we used that to build, first of all, a simple use case, and then expand that into a very detailed document describing the multi-layer menus of the Science Gateway. Then we prioritised the gateway itself, the functionality, to see what we can map onto what's already existing, and then using that to then leverage into new services. Okay, so that gateway is sort of 50% works, 50% is on a wish list, but it's kind of a metaphor, if you like, for how pharmacological communities of practice could collaborate. Then moving on to the Trojan database, which we did with CAR, that in some ways is much more simple because that's connecting data repositories together. So we work with them to produce that, and again, that's a great example of how communities of practice that own data can use a science gateway to promote that in a worldwide collaboration, etc. And we're going to see examples of these this afternoon. But basically, it's doing the hard work of talking to the communities, trying to find out what they want, then using our expertise to translate what we know about the technology into things that they can use, and then using the Science Gateway almost as a planning tool to capture those requirements and gradually translate those into actual tools that can be used. I hope that answers your question.
Okay, thank you very much, Simon. Yannick talked about the status of e-infrastructure within Europe. Yannick is the gentleman from the European Grid Initiative. Does anyone have a question for him or a comment that he can respond to? Yes, please.
Thank you very much, Lars Gustafsson, Stockholm. It was a very nice presentation, and you clearly did show that there are potentials, both with the technology as such and using data. And you also said that there are plans to plan for the future. And I wonder, and this is irrespective if it's Europe or it's Africa, you commented that a planning group was to be, delegates were to be appointed by ministries or governments. Could it be possible to have a way forward for such a group that they should be appointed after consultation with national research councils? I think this is a simple issue, but I think it's important because if you include scientists from various groups, they are early users. And I mean, if you see the networks taking place that have been in the science field. So my question is, could you make it a little bit more, this type of important group related to the scientific communities, either Africa or Europe?
So I don't want to talk too much about these groups because they are, let's say, led by the member state, as I said. What I could say that, for example, in EIRG, most of the member states have appointed 2 delegates, one from the ministry and one from a research council. In most of the case, you have both someone representing the political ministry and the other one representing the scientific area. In S3, I would say that this is even more scientist people who have been appointed to represent the member state. I know that in the back of the room there is Professor Gabrielle von Voigt, who is the coordinator of the EIRG SP4 project, which support the EIRG group, so probably she can give more information about the composition of EIRG, and you can discuss offline with her. So I don't know if it answers your question.
Okay, thank you very much, Yannick. Then from a totally different perspective, we had the I-mentors brought in by Louis and John. Who is doing what in Africa and how can they be brought together for common benefit or creation of synergy? We shall accept 2 questions for them, and I see 1 question here.
John War, Irokamano, Edinade. Databases are, of course, essential, but they are quickly outdated. Will you keep the updating centralized, or the ones mentioned in your database, will they be able to update themselves the information? And what is the incentive?
Any of you can answer that?
Yeah. Well, actually, it's a good question. It's a shame we haven't mentioned it actually during the presentation. The database itself is actually integrated with the World Bank database and the Cordis database, so the EU database. It's not automatic because it implies that, well, to some extent, some moderation is due. Mostly for the purpose of interconnecting, but I mean we're working on something a bit more permanent. But also, sometimes the search function is dysfunctional in the sense that the database which you connect to fetch the data will provide you with a bunch of projects which may not be related at all with the topic. However, it's been done in a way that's semi-automatic with a very minimal input needed. The idea is that in case we extend this project, there is a discussion that we might bring this project to South Africa or another region. We will work on finding a way to minimize it even more. It's not comprehensive, but there is need for some moderation. For the moment, we will handle that, even if the iMentors project is not continued in a project way with proper funding. We will still maintain it and provide support, because a lot of information we receive is also coming from users themselves. So there's a lot of crowdsourcing, which involves some research to some extent, back and forth with the person who's providing the data, and then a double check as well. For the moment, we will take care of this. If we get money, of course, we will even extend this. And I mean, the problem with integrating databases is that typologies are not necessarily similar. Frameworks are not necessarily similar. But we have adapted also this to the EATI standard, because the idea is that CEDA will adopt the platform for its own development aid. And we have managed to perform an integration also with the EATI standard reporting format. It's working. We still need a little bit of work on this, but hopefully by next year they will be able to report their own ICT development aid directly through iMentors on their own.
Okay, thank you very much, Lou. Does anyone have another question for, yes, the lady there, please?
Hi, can you tell us a little bit about the social hub? You said it's one of the objectives, so some evidence of how this is working?
The idea of a social hub is that people can find other people can find other projects, people can find information on projects. They can choose to communicate through the platform because we provide those tools. They can choose not to. We don't impose on people to necessarily, the data is open. We don't even impose them necessarily to register in case, if they just want to see the project themselves, they don't need to even register. If they want to edit any information, yes, they have to. That's for us the social hub kind of approach.
Okay, just to add on to that, I think what we mean by social hub is the fact that different actors can find each other. So donors who have funded particular type of project and can find each other, and they have contact details so they can pick it up from there, whether it's through the phone or through emails. Researchers can also find each other. So basically, it's a meeting point for different people with interest in e-infrastructures in Africa. Or a funder could find somebody who implemented a project that they're interested in funding and where it was implemented, and then they can contact somebody from another part of the continent who may benefit from that. So that social interaction is enabled through the platform.
Okay, thanks a lot, Louis and Simon. Is it a follow-on?
Yeah.
Okay, I'll permit that one.
Hello everyone, I'm Ksenia Rubikondo. I'm an evaluator of the projects funded by DG Connect, and I have a relevant question to the presenters, to Louis and to John. So it's really great initiative to put people together, to connect them together. So actually, how many researchers have connected? How many organizations put their efforts together using your platform? Is there any research project or, I don't know, collaborative partnership that has started? Because from distance and being in this ICT field, it looks like, we have all those awesome virtual worlds and they are functioning, but people are saying we don't know about it in Africa. People are saying we don't know, even I went to iMentor platform, there are no web links that are supported that I can go into the web and learn, does this organization really fit my partnerships idea, where I can get more. So what is real in real life? What is the added value of your project in real life?
Can one of you respond to that? Just one of you, please.
Well, I mean, it's been used. We have actually sent a lot of feedback to organizations who have actually put back, responded to our call to upload and update the platform. So that's one thing. But in terms of facilitating interaction, again, as we say, we don't force people to communicate through our platform. But for me, I have personally facilitated through the platform, for instance, the opportunities that provided to see that, so then project managers can actually go there, perform a risk analysis, and then be able to have a better idea about who else is involved in those fields, what they are doing, etc., so that they can actually build on synergies and so forth. Now, I'm not sure if this actually responds to the question itself, or if you want numbers about how many practical interactions that have occurred during the platform. This is something that's very difficult to measure because we don't have the requirement of, or we don't act as the broker. We don't have this idea of facilitating ourselves the two connections. People can do it themselves. But maybe we can, not to avoid so much time on this, maybe we can talk about this later on.
Okay, thank you. Louis, that can be continued over lunch. Now, the last question we are taking is to Amos, who gave the status of e-infrastructure specifically in Tanzania. Does anybody have a question or a comment for Amos Nungu? Yes, please. The lady from Zimbabwe. Was it Zimbabwe? Yes. Please.
From Zimbabwe. Yeah, thank you very much. My question is on the issue of the e-platform is a very splendid arrangement, but how secure is the platform? How difficult is it for me to get onto the platform, get some information, and claim it to be mine? Are there any firewalls so that people don't tamper with the platform? Thank you.
Okay, thank you very much. Is this specifically for Amos?
This is sort of general.
Okay.
Yeah, Amos can answer, but if there's someone who thinks they might answer the question better,
okay, thanks a lot. We'll let Amos field it first since it was his slot. Then after that, you can get a supplement. Amos, please.
Thank you for the question. Yeah, by talking specifically for Tanzania, and I assume you are referring to the Science Gateway, which we plan to have it in Africa. Of course, but it was for knowledge transfer, but also sustainability issues. And as it is kind of an outcome of the EI for Africa, so be assured that all the standards of EI for Africa or the Farmer Science Gateway are taken care. So if we talk about security, so it is the same level as the current Science Gateway, which is currently hosted in Catania. And for the capacity building, knowledge transfer, I mean, that's what I said. I mean, we are doing it now. And I'm assuming it is a continuous process. And as the IMETA said, also for the EI for Africa, we have submitted a proposal for an extension. And we believe that it will go through. So we hope to extend it beyond the current status. And I think also it is an ongoing process that, for example, Zambia, I mean, they have just come on board. And I think Zimbabwe and the rest through the Ubuntu Alliance, I mean, the efforts are taken locally in Africa. And we plan to replicate whatever is being done now with the same standard at the local level.
Okay, thanks a lot, Amos. That will be supplemented in the next phase of this discussion. I've got 2 more phases, actually 3 more phases in this discussion. We've got some distinguished panelists who have been soaking all this in. I've got here Professor Roberto Barbera, Professor in Experimental Physics. I've got my all-time colleague Edmund Katiti, probably first saw him about 40 years ago. And another panelist is actually sitting in the audience, Leonardo. We shall be requesting each of you to make, starting now, 2 reflective comments on the presentations that were made by our colleagues. So I'll start with Roberto here, then move on to Edmund, and then move on to Leonardo. Roberto, you could make a further comment on the question which was just on the floor before you make your reflections.
Okay, so a couple of comments that I have on the slides. So first of all, I mean, we have talked about several aspects of the infrastructures. I mean, high throughput computing, high performance computing, open access infrastructures. This is very good that the ecosystem of the e-infrastructure is diversifying. I think that's one of the key aspects and the key issues in this is to keep all this aspect interoperable, all these different services interoperable. So I think that's one of the most important issues that we have is to identify and leverage on standards, because interoperability, it can be ensured only if official standards are adopted and exploited. Concerning still concerning the infrastructures and the services, we have seen services for data infrastructures, for high throughput computing, for high performance computing, for open access, but I think that we are missing a big initiative on education and training. I haven't seen a large initiative spanning Europe and external regions, other regions, on education and training. We are trying to promote e-infrastructures and try to promote new ways of researchers, new forms of researchers, but we still miss a large initiative on creating these researchers from the low level, from their degree, I would say. And the last comment on open access and all the rest, high throughput computing, high performance computing, and so on. There is a very important discussion going on in different areas about the reproducibility and extensibility of science. We have the scientific methods since more than 4 centuries, but we have huge papers, nice papers with nice results, but we have very few methods to verify, to reproduce the science inside the papers. Having the paper in open access doesn't help much. So I think that we should try to invest on the effort to connect open access repositories with open data, with cloud infrastructures, with the e-infrastructures in general, to let interested users, specialists, but also citizen scientists, to be able to reproduce the science inside the papers and extend eventually the scientific results. So the concept of openness should pervade, should percolate from the papers, which are the last product of research, down to the data, to the application, to the code, to the software, and to infrastructure that can be used to reproduce this paper.
Okay, thank you very much. Edmund, if you can talk.
Thank you, Francis. As I have been listening, I've been trying to make connections with what we within the African Union structures can do to assist in the work that you researchers are doing in creating these infrastructures and so on. So I thought I should mention one area which I think might help to get us together. In the area of infrastructures, the African Union is building what we call the African Infrastructure Database. And within ICTs, we have taken the broadband infrastructure and put it in a GIS map. And this is going to be available online before the end of the year. And it is available for anyone to propose updates and inputs and corrections. And we have put infrastructure in place in terms of focal points within each member state of the African Union to be able to verify the information that is requested for update. And this, being part of the PIDA program, will be reported on at the African Union Summit through the VPIC system, the Virtual Information Center, about PIDA. And I believe that if we have linkages with some of these networks that you have created, they can be highlighted in this mapping and be brought to their attention, but also begin to think about the kind of impact that they are getting so that we can give them the relevant attention at the heads of state level. I thank you.
Okay, thank you very much. Leonardo.
Okay, just very briefly, a closing, for me, a closing remark, because I was reflecting. I'm going to comment on the context, because if you remember when we started, or you started, what was the connectivity infrastructure problems a few years ago for Africa, we were starting really from ground zero. Yeah? And I was watching the presentations and the comments and the discussions, and in only a few years, the immense advance that has been done, not only by the programs that we have supported, but also with the programs that the African Union Commission is supporting, the other projects. I mean, there is a wave that is, rising, that I think that we have to keep the momentum. I mean, it's hard for you to believe that, okay, a few friends in IST Africa a few years ago were meeting and saying, okay, what will we do now? We have this project, let's start almost from scratch. And I see today there is a lot of effort being put by, as I say, from the National Research and Education Network, by the institutions, by the regional research and education networks, and what is more important that we have to concentrate is on the research communities. And the research communities and the public authorities, they have to be aware of this, and because it's really putting Africa at the same footing with the other regions in the world in the research and education arena. So this is my reflection, that from the context, the impressive advancement that we have witnessed in only a few years, starting from where we start.
Okay. Okay, thank you very much. Thanks a lot, Leonardo, and thanks our distinguished panelists. Now, I'm going to throw a question at everybody sitting at this table, a real current case, so that we can see what kind of intervention would recommend from the perspective of what you are advocating in your presentations. We face a global challenge now of Ebola, 5,000 plus dead, more than 10,000 infected, and we're talking about relevance and showing benefit to communities of practice. I think somebody said that this is about the applications at the end. So bring your combined skills on the table now in a single statement. What would your response be as somebody who is advocating whatever you have been advocating? We shall also open this to the audience because we are scientists and public health specialists and so on. We deal with real challenges. Who wants to go first? Yes, Simon.
So if you can remember all the way back to my presentation, you might have noticed that I direct a modelling and simulation group. And this is one of the things that we don't really address as an infrastructures community, that there are common requirements for high-performance networking, requirements for high-performance computing, but then there's common requirements for techniques, mathematical techniques and operational techniques to be made available to scientists. So, for example, modelling and simulation has got a good old tradition about infection modelling using agent-based simulation, and making those tools available now to people who are studying how the outbreak is spreading, and using those to brainstorm and use what-if scenarios to understand policies and evaluate them those based on an infrastructure, I think would be highly useful. That might be a bit direct, but that's an idea.
Okay, thank you, Simon. But you don't have to respond to this if you don't want, but if you have got an answer, please indicate it and we'll give you a chance. Yes, Leonardo, please go ahead. You have an answer? I mean, Leonardo.
Okay, for me, there's not much to add, but I think that, for instance, the Ebola case was an illustration of how the lack of connectivity, the lack of responsiveness from transmitting the data back and forth, a few weeks were lost. A few weeks really that could have been saved in the response. And I think that's also to reflect upon that.
Okay, thank you. Yes, Amos?
So if I can share a case, I mean, in Tanzania, for example, currently we're empowering the doctors to share knowledge and experience on Ebola, and especially for those remote areas. So we have set, a network, part of it is the, internet, the NN. Now, there are a few doctors who are very familiar with Ebola, and the rest they're still catching up. So every Wednesday, they have kind of a session, which is an online. So kind of that is something which we are doing through the infrastructure.
Okay, so you now have an online platform for information sharing. Thank you. Anyone else? Anything from, yes, John?
I think for me, with the one foot standing in Europe and one foot standing in Africa, having experienced both worlds, I think the discussions today could be made more useful, particularly to researchers and students in Africa to access internet connectivity. I remember I still use my account from my PhD university, which is in England, and I come to Belgium and I still connect to the internet through EduRoam. And it's such a simple thing, password. I think the connectivity that can be created within the African continent can help a lot in research and learning in that respect. For example, if we are looking for practical examples, I know some countries have launched this kind of connectivity, but it could be spread across the continent.
Okay, thanks, John. Yes, Yannick, you have something from computing.
I will dare to be a bit provocative and controversial. What I would like to recommend to both the European Commission and the African Union Commission is to extend the huge effort you have produced for the connectivity toward the upper level of the e-infrastructure. Because in the past year, most of the action we have been able to set up, if I'm not wrong, were mostly coordination and support action. And I think that now that the connectivity starts to be much better between Africa and Europe, we can go for a real and concrete research project. In my previous life, I was mostly involved in handling healthcare and biomedical data. And I think that we have a lot of case in Africa, a lot of actors, and we have also private donors who would be very happy to contribute if they could get some support to collect and organize the data. And the knowledge we could accumulate on a lot of disease or situation would be, I think, invaluable for all of us. And this is what I would like to advocate, that we should go for a real research project and learning how to share data between Europe and Africa and create new knowledge.
Okay, thanks a lot, Yannick. Yes, Edmund.
Yeah. I think ICTs have played a very important role so far, a positive role in being able to report cases of Ebola happening in different towns and cities in those affected countries. They have played an important role in informing the public and abating the panic among the public. And I believe if we had better connectivity in those countries, the impact would have been greater. So I think this is a good example of the positive impacts of this technology. And the more we have, the better it can be in situations like this.
Okay, thanks a lot. Roberto, any comments?
Well, I mean, there are two aspects. One aspect of Ebola is, of course, to find a long-lasting solution with a vaccine. The problem is that the finding of a vaccine and the testing of vaccines against Ebola is very complicated. You cannot inoculate the vaccine to volunteers. So I think that e-infrastructures have already tackled similar problems. I'm not saying that solutions are there, but we already tackled similar problems. I mean, Yannick in particular may remember the time a couple of years ago, I mean actually more than a couple of years ago, when we launched the in silico simulation of molecules that could be used as vaccine for malaria. Terabytes of that have been produced, several molecules have been found, but then I don't remember how this ended. I mean, I think that the molecules were passed over to the pharmaceutical companies for some in vitro testing, and I don't know what happened. Maybe Yannick can comment. From the EI for Africa perspective, in our small little universe, we have put forward the concept of the pharmacology science gateway that is demonstrated out there, where we are integrating applications, code that can be used to study molecules. I'm not saying that running the the pharmacology science gateway, we can find the solution for Ebola tomorrow or in a week or in a month's time. But the concept that we would like to put forward is that we have easy ways for researchers, for bioinformaticians, to access huge infrastructures and run programs that can help identify molecules. On the other hand, not a care, but a limitation of the spread of the Ebola resides in information. For this, I mean, not for the Ebola, of course, but in general, we have tackled the problem with another strong and important piece of the Science Gateway, which is the Community Health Portal, which has been mentioned at least twice by Simon and by Amos today. In the Community Health Portal, we have two services that are already used for other purposes that could be maybe used for Ebola or other disease. One is a drug availability service, where people can discover where is the next place where they can find drugs and try to book and find and get these drugs. And another service which I think in the short term is very important, because one of the problems of Ebola is the information about to treat people affected. In the Community Health Portal, we have another module, which is a training module, which has been used for completely different purposes. But I think that having training modules for safe operation could help operators, medical operators, and other kind of people close to the infected people to operate in a safer way. So I think that there are several possibilities for the e-infrastructures to tackle these big diseases and try to find solutions. Of course, I mean, e-infrastructures and technology people are not enough. I mean, political decision and the investment from the pharmaceutical companies are important as well.
Okay, thanks a lot. We're going to take 3 comments from the floor. I know there's one already. Before we come back to the panelists here, to give us each one key take-home action in terms of promoting e-infrastructures and their exploitation, not just within Africa, but jointly between the world and the rest of Africa. So please think about that as we take some comments from the floor. I see this lady, I see the gentleman there. Please, go ahead.
Yeah, thank you very much, Mr. Chairman. On the fight Ebola, SES with a satellite operator, we have actually a reach in the region of 20 million people. We know that from discussing with the African Union and the European Union in Addis Ababa, that information and communications to the populations is already missing. You know, it's not spread as it should be. So what SES has decided to do is to launch very soon and use the satellite capacity we have over the regions to inform the population on that, and we're working together with OMS and WHO on that. So this is what, you know, satellite can do, is reach immediately, I mean, everybody in the coverage, so Liberia, Sierra Leone, Guinea, but also all the neighboring countries who could be affected tomorrow. Second thing is that we have, through emergency.lu, which is a partnership with Luxembourg, we already have 5 inflatable antennas, which are in Ghana, ready to being deployed in Liberia, Sierra Leone, and Guinea, where the communication is needed. And this is for health and medical doctors and the teams. And thirdly, we will deploy, together with the Belgian government, a mobile laboratory, which will be deployed in Guinea to evaluate the spread of this epidemic. This will be done with epidemiologists, of course. And again, satellite will be there for the connectivity. So this is satellite, we've not heard about this today, and it's not present in e-infrastructures. And I regret it. And I just wanted to add that if we look into the map of Ubuntu.net, yes, there is a lot of progress, and this is great and fortunate, and fiber is spreading. But there are still a lot of countries in Africa who have not this possibility. And so that's the reason why we've launched a constellation of satellites called O3b, which will bring gigabytes of capacity over the region, which allows fiber connectivity to universities who are today not connected. We were talking about the students. Internet connectivity for all the students in universities is as important as connecting the researchers. I just wanted to add that, and so for Fight Ebola, we will, contribute, I hope, to some, information to stop the spreading of this terrible epidemic. Thank you.
Okay, thanks a lot. There's a gentleman in that corner, two gentlemen actually, both of them at the end.
Thank you very much. I would like to comment on what should be possible to do as cases of Ebola. 2 days ago, BBC did publish the map, a mapping scenario of the Ebola cases in Africa. And what was significant was the cases in Guinea, Sierra Leone, and Liberia. So as infrastructure, and the projects that we're doing, we should be able to assist in that using, for example, Ushahidi mapping, which has been popular in the past in several cases. It could also be used with this, not only focusing on a few countries, but the global mapping, which could be in the background, be supported by mathematical modeling skills like Hilbert spaces, but also Bessel functions. And therefore, capacity in these mathematical tools should, on modeling and simulations, should be enhanced through these kind of projects. Secondly, it's an aspect of sensing and detection. We have seen in all the airports a lot of queues to do sensing and detection using thermal probes on passengers, aircraft passengers. And I think some of them are not very accurate. And us as technologists and researchers in these fields, we could, for example, propose two methods. One is based on near-field communication, based on the smart devices we're all carrying, and also neutrino probes using nuclear techniques, based again on the devices, smart devices that we are holding, for example, a mobile phone, which all the time they're radiating signals, and we deal with these signals all the time. We can use these signals to detect the temperatures of the owner and communicate to any other point, and also using the GPS enhancement on the devices to map the individuals and also do statistics on the same. We should be able to hand over all this data into whatsoever databases we're dealing with. So I think these are the propositions we can do to do real-time analysis and statistical. Thank you.
Okay, thank you. Last comment from the gentleman there.
Thank you, Lars Gustafsson, Stockholm. It's a comment for future suggestion on investments, and I would like to have a comments from the panelists. It builds on what Roberto and Yannick have said. I think Africa has a lot of richness. It's no continent that has taken up mobile phone in a way as Africa. So thereby it's an asset. And we now see, for example, in Somalia, going back to a little bit more normality, building on that they have advanced mobile phones and also building up e-infrastructure. But what I'm specifically thinking about is that concerning data and networks in medicine, as I represent in life science, Africa has unique type of data everywhere in the demographic surveillance sites. So it's a group called In-Depth. It's similar to other professional networks. It's building on a long tradition. It's about 20 years to monitor resistance towards malaria. Those demographic surveillance sites is, as Yannick said, it's a type of data there. It should be explored. Thereby, it's very important in the next future set of rounds on funding from EU to have related to this type of data. And I think this data can be used to monitor if you get new type of infection like Ebola. So it's a way of prepare for other possible viral or bacterial threats. So I think the mobile phone awareness and use, the example of Somalia, and the data sitting there in demographic and other surveillance sites. That's a possibility for African scientists to take the lead, and new models building on e-infrastructures.
Okay, thank you very much. Now, the audience borrowed 8 minutes from our panel during break time, so we are borrowing it back. Thank you very much. We are going to ask everybody here to give their just a single take-home action idea about what we have been discussing. If your idea takes more than 30 seconds to express, I think to be a bad idea, so don't take more than 30 seconds. Who wants to go first? Let's start with Roberto. Not more than 30 seconds, please.
Yeah, I think that 3 things are very important to spread the exploitation of infrastructures in Africa. First, I would say education and training programs, effective, that can really focus the interest and raise the skills on these technologies. And then I will try to link with the questions that has been done before, make the deployment of services and the access of services easy and transparent, yet secure. So I think that not only access in an easy way through portals or mobile phones, but deploying in an easy way, in a transparent way, in a reproducible way, infrastructure services can help in spreading them.
The countries of Guinea, Sierra Leone, and Liberia lie in an area called the Manu River Basin. And it's been known for some time that this is an area that has the lowest telephone mobile penetration on the African continent. Is it just a coincidence that this is the area where Ebola has come and persisted, while in places that have better penetration, like Nigeria and Senegal, they have been able to effectively deal with it in a short time?
I agree with Roberto about the interest of infrastructure for healthcare, for tackling up after the big pandemic and epidemic. But this takes time. To have a drug that you can use on a daily basis, it takes more than 10 years. So that's an issue. What we can do already, we can also try to target some other aspect while not abandoning that one. But for example, we can support the establishment of infrastructure for e-government or for some other medical aspect which doesn't touch the clinical trials. Like, for example, a malaria test. I know some countries in Western Africa, we have started to conduct some experience to collect result of malaria tests, which are a very small amount of information transmitted through a mobile network, and you can also have payment through mobile network and things like that. So this is very common in Africa, and I think that you are one of the first adopter of the payment through mobile phone. And I would like also really to target action which may have a very social and human impact, such as, for example, there is another initiative I know which tried to fight against counterfeit drugs, which is also a huge plague in Africa and which kill a lot of people. And installing such e-infrastructure for serving such needs may really help in the short or medium term.
Okay, thank you very much.
Thank you. Personally, I think the investments will never surpass the demand. And I think, for me, take home from this meeting is we should try to demystify ICT among our colleagues that you interact with from different professions, so that ICT does not remain a computer scientist's special world, especially in the African continent. I may be wrong, but in Europe, ICT has moved from the computer science department to everyday living. So I think with all the professionals that we interact with, we should try and demystify ICT because they use it in different ways, but new initiatives tend to be resisted because it belongs to the scientists. For example, Apple Corporation, the big American company, just introduced payment by phone. But in Kenya, they've been using M-Pesa for the last 10 years. So scientists in Kenya, do they know they've been using this ICT in their social life? Maybe not. I think we should demystify this specialist area that others see as not belonging to them, so that the little investment can be used by people across different sectors of the society, and that will create kind of demand for more and probably encourage private investors to come in and carry forward what central governments can't fund. Thank you.
Thank you.
Okay, very quickly, I have something, an invitation for you to take home, because I hear a lot of ideas on the, let's say, the vertical e-health, e-government. I think that in the Commission as a funding agency, we have a lot of programs in the research, in the research area. We have the DG Research that covers this. We have international cooperation. We have development and cooperation DGs. And so I will invite you, when you prepare a proposal, when you think about even at national level of your national development agencies, we wanted this data from Africa, we want to cooperate with this, to ask yourself, where is the infrastructure component? And include in your proposal systematically support for the infrastructure and link with the entrance, with the regional rents, and do that systematically, because so far, this has been a bit disconnected. Now is the time for the people in e-health or to say, okay, I want support to create this database and be open, and the infrastructure can support that. So that's my invitation to you, to include infrastructure in your ideas, in your proposals, and to be infrastructure pervasive to all areas in research.
Thank you.
Yeah, to my experience, the idea of build and they will come, it is very expensive. So I think, from the UN, when we are planning for these infrastructures, we should try our best to involve the intended users. And as one said, it is not only the ICT guys. And most of the infrastructures, the e-infrastructures, they do complement all other activities in life. So we should try to be inclusive to all those who are supposedly to use or complement those infrastructures. Thank you.
Yeah.
And last but not least, so anybody in this room got students? I have students. I want to get them partners. So I think it'd be really exciting to explore how we can get African students and European students to join together to build science gateways or similar things. There's international initiatives that give a framework for that. So as a sort of last message, I think we can really, really energize things by getting good partnerships together between all our students and really build a foundation for the future.
Thank you very much, colleagues. I think that was wonderful. Thanks for the interventions, and we thank the audience. Can we all join together in a big hand clap for everybody for a wonderful session? Thank you. We are supposed to be back at 13:30, please, for the afternoon session.
Yes, so everybody, there is a lunch that will be served on floor 0 upstairs, so you can see some natural lights at last. Be sure to be here at 1:20 because the conference will start back at 1:30 sharp.